Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Trandolapril, or Mavik by its brand name. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then discuss examples of dosing and follow it up with side effects with percentages. I put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Trandolapril inhibits angiotensin-converting enzyme, or ACE. It is believed to lower blood pressure by suppression of the renin-angiotensin-aldosterone system. Inhibition of ACE blocks the conversion of angiotensin 1 to angiotensin 2. This causes a decreased vasopressor activity and decreased aldosterone secretion. Trandolapril may also increase levels of bradykinin, producing a vasodilating effect. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of hypertension or high blood pressure, as well as in the treatment of congestive heart failure following a heart attack complication, or left ventricular cardiac dysfunction after a heart attack as well. With respect to contraindications or reasons we would not be able to prescribe this medication, we wouldn't give this medication to a patient who had a hypersensitivity to Trandolapril, any other component of the formulation, or to other ACE inhibitors. It's not to be used with aliskiren in diabetic patients, or with neprilysin in inhibitors such as sacubitril. History of angioedema related to therapy with other ACE inhibitors would make it a contraindication. And as well, patients who have hereditary or idiopathic angioedema would not use this medication. Now for some examples of dosing. So in hypertension or high blood pressure, the initial dose would be 1 to 2 milligrams orally once daily. The starting dose may be different based on race and if a diuretic is used in combination. Adjust the dose at intervals of at least 1 week, and the maintenance therapy would be 2 to 4 milligrams orally once or twice daily. The maximum dose would be 8 milligrams daily. In the treatment of congestive heart failure, the initial dose would be 1 milligram orally once daily, with a target dose of 4 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Trandolapril, so I'll go over some of those here now. 0.3 to 5.3% of patients may experience hyperkalemia or an increase in their potassium levels. 1.9 to 35% may experience a cough, and 0.5 to 11% may experience hypotension or low blood pressure. 6% of patients may experience syncope, and indigestion may happen up to 6.5% of the time. Dizziness may happen 1.5 to 23% of the time. Now, 2 serious side effects that may occur with this medication would be intestinal angioedema or cardiogenic shock. Alright everybody, that's all we're going to talk about today with Trandolapril or Mavik. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.